Hello everybody, this is Dr. Amritha Shetty and welcome to this video on first trimester and everything that you need to know about the first trimester, right? So first of all, since the uterine pregnancy test is positive, congratulations to you, and I hope this video will be helpful to understand and to navigate through your first trimester, right? So without wasting much time, let's start the video. The first trimester typically starts from the first day of your last menstrual period and continues up to 14 weeks of pregnancy, right? What are the common symptoms that are present during first trimester? First is nausea and vomiting. The patient might feel very nauseous to certain kind of smell or to certain food items, and this is very normal, and there's nothing to worry about it. You can kind of shift your diet to having small and frequent meals, and also avoid having spicy and fatty foods. You can switch to bland foods instead. Okay. And also sometimes candies or ginger candy can help you in to some extent, but there are patients who feel nauseous, or severe nausea during the first trimester. Those patients might require admissions. But the good news is, as the pregnancy advances to the second and third trimester, the nausea gets better, and hopefully kind of stops as you get into your second and third trimester, right? That's about nausea and vomiting. Secondly, patient can have increased frequency of urination. As you know, the body changes from pre-pregnancy to pregnant state. There's a lot of changes that happens in your body. The kidneys are working harder and there is fluid shift. So you might be having more uh, frequency of urination, which is also normal. There are times when you have to get up in the night to pass urine. There's nothing to worry about it. It's a normal symptom. Okay. And thirdly, you can have something called as heartburn. Heartburn is very common in first trimester because there's something called as delayed gastric emptying. So your whole digestive system kind of gets sluggish, and the food particle that's present in the stomach, or the acid material, can kind of reflects back to the esophagus. Okay, so that was the third symptom. Fourth symptom, patient can have constipation. Like I said, the whole of digestive system kind of gets sluggish because of the hormones that are secreted during pregnancy, the progesterone hormone. The bowel emptying also will take longer time than it usually is, and that can be constipation, right? And the next is pain. A lot of patients complain of pain or cramping during the first trimester, which is also physiological, because the uterus is undergoing massive change when it's turning into pregnant state. So a little bit of cramping or pain is also physiological. Um, you can visit your gynecologist and get yourself evaluated when you feel a lot of pain, or especially if the pain is severe, right? The next symptom would be spotting or bleeding PV. A lot of patients kind of panic when they have spotting or bleeding. Of course, you have to get yourself evaluated, but you need to know that about 30% of patients who have normal pregnancy outcome do experience some amount of spotting or bleeding uh, at some point during their pregnancy journey. Okay, these were some of the common symptoms that happens during the first trimester, and I hope the video was useful. If you have any comments or any queries, please mention it below and I'll try to answer them all. So thank you.